Okay, so it is now right in the middle of cold and flu season. I just came off a day where yesterday I had to call off of work because I was under the weather. And by under the weather, I mean I can't remember how many times I went to the bathroom because I had to use the bathroom. I was losing things from both ends. So I think it was with some GI gastrointestinal bugs. Regardless, I'm feeling better today. But I realized how many times I talk to patients about what to use over the counter to help with some of the symptoms they're having. So in this video, I'm going to quickly go over some of the things I use as a doctor on myself if I'm feeling symptomatic and not needing something prescription. Because how many times have you talked to your doctor and said, I really feel sick, I have something, and they go, oh, it's just a viral illness, or it's just a virus, you don't need antibiotics, and then you're kind of left with, what do I do now? So I'm going to go into the pharmacy right here. This is Rite Aid, and I'm going to go over some of the things that I use for me and my family when we're feeling sick. Again, this is just sharing what I use. You should consult with your doctor too if you should be using some of these things, because some of these medications I don't advise all patients to use. Sorry for having to do a voiceover here, but there was copyright music playing in the pharmacy and it got caught on the audio of the video. So over here we have some of the digestive, or some of the medications in the digestive system or section. There's kaopectate, Imodium, and Pepto-Bismol down below. But these are common items that are found in most pharmacies here in America. Here on the top are the antacids. You have Tums and the generic for Tums. They're basically fast-acting medications, so if you're having upset stomach or reflux or heartburn, you can take some of those and it should be quick relieving. Just again, look at the directions for the maximum you can take. I paused here over the Alka-Seltzer because I wasn't sure why they had Alka-Seltzer in the digestive health section. If you look at this Alka-Seltzer, it has aspirin in it as well. And even on the front of the box, it says it's for headaches, headaches, backaches, body aches, and muscle pain. So I wouldn't necessarily use this for heartburn. So I was kind of confused with the placement of this piece of medication here. Now down below here you have Imodium and Pepto-Bismol. So these are the things you can use for relieving diarrhea. I don't typically jump to using these medications. Often when you have acute or new onset diarrhea, it does go away after a while, and yes, it might be very uncomfortable. Trust me, I was back and forth for countless times the other day, but I like to let it run its course, literally and figuratively. So I try not to jump to using the antidiarrheal medications right away. Down below is the pink stuff, the Pepto-Bismol. Over here, we're at the allergy section. Now, often here down below is the fluticasone and triamcinolone nasal sprays, and Zysol on the right. So these are over-the-counter steroid sprays, often used for sinus or nasal congestion or even post-nasal drip. Sometimes with some viral illnesses, I'll have people use this for the congestion. There's not a ton of great data for its usefulness for that, but I think it might help with in terms of relieving some inflammation. It's one of those things where probably very low risk of systemic side effects since you're just using it topically or as a spray. We are going to move on to the right soon, and let's see, here we have some of the saline rinses. These are great. So there's some saline sprays you can shoot into your nostrils. It can be definitely uncomfortable. You've probably seen videos of this on TikTok or social media of people doing that with their babies, but it really helps clear out the sinuses or the nasal passages with all that mucus. Up above are the neti pots. Those are another option. Just make sure to use distilled water. But you fill it up with that water, then you stick the point in your nose and you squeeze and you just clear everything out. It can be very satisfying to watch in a video. Not satisfying if you're doing it to yourself. And here in this section we have the decongestants. Sudafed is probably the most commonly remembered name, but to the left and the right are some decongestants that are non or generic. But it is important to note in these products here that they have multiple ingredients or multiple medications. Again, Sudafed, often used for congestion or decongestion. It helps with relieving that. The ingredient here, or the ingredients here, include Tylenol, which is acetaminophen there. It has dextromethorphan, which is a cough suppressant, guaifenesin, which is an expectorant, and then phenylephrine. That last ingredient is the decongestant or decongestant. So I often don't recommend patients with high blood pressure to take something with phenylephrine. Phenylephrine can cause blood pressure to spike. So that is something to be aware about when you're looking for some over-the-counter remedies for your symptoms of colon or for your cold and flu symptoms. I know it's often thought to be more convenient to have just one pill that has everything, but the drawback is you have to be really careful about what's in it. So pay attention to that if you have high blood pressure. There are other things you can do for people who have high blood pressure, and I'll show that later on in the video. And up here we have the cough drops and throat lozenges. Now, they all work in a similar fashion. They're there to soothe your throat, help it feel a little bit better. I don't have a preference in terms of efficacy, at least nothing that I recommend. Personally, I like the Ricola Originals just because that's what I used to have as a kid, or when I was a kid, and I like the taste. But just pick and choose what you like better and go with that. And here we have the Mucinex branded products. Now, Mucinex DM has guaifenesin and dextromethorphan. As you can see, these are the same things that were in the decongestant previously, except this time only 2 medications are there. The guaifenesin is the expectorant, and the dextromethorphan is the cough suppressant. The nice thing about that green box at the top is that it's a 12-hour pill, so you can take one pill twice a day, and that should help with the cough. Some people don't like the pill form, so this here is the form in liquid. So it's sold as Robitussin. This one, though, has an antihistamine, so that's why it's a nighttime, so it can help with sleep as well. Down below is Delsym. That's another common one I've been asked about by patients in the past, but if you look at the labeling, it is dextromethorphan. So it's the same thing that's in the Mucinex up above with the, well, I guess it's just the suppressant rather than a combination with guaifenesin. Again, the nice thing about this is a 12-hour cough relief, so theoretically you only need to use it twice a day, and that should be helpful for the cough. The other one here is the Robitussin DM. Now this has the dextromethorphan and the guaifenesin, as you can see on the box here. So essentially it's a liquid form of the 12-hour tablet up above. Honey is added for taste. Here we have the popular Coricidin brand. As you can see on the box, they're all advertised as something for people with high blood pressure. So this will not have any Sudafed or phenylephrine in it, but it has a combination of a pain reliever, which is the Tylenol or acetaminophen, an antihistamine, which in that case for the liquid was doxylamine, and it has dextromethorphan, which is the cough suppressant. I think the ones on the right, the boxes over there, instead of doxylamine as the antihistamine, these have chlorphenamine. So again, this is one to consider if you have high blood pressure as a existing diagnosis and you're trying to avoid having the spike in blood pressure. Over here we have the over-the-counter pain relievers. So starting on the left, we have aspirin, then you have Aleve, then Tylenol just to the right of it. Aleve is also known as naproxen. Naproxen is a non-steroidal anti-inflammatory medication. It's in the same family as Advil or ibuprofen. So be careful with these medications in terms of when you take them. They should be taken with food. I know when I have taken high doses, I often have really bad heartburn if I'm not careful or if I don't remember. So it can have an association with the stomach or GI issues. So people who have history of GI bleeding should probably not be taking these medications. It also has some risk with the kidney for a long-term high dose. Now, Tylenol is also known as acetaminophen. This one doesn't have the same effects in terms of the side effects with the stomach or kidney. So that one is an option for people who have chronic kidney disease, but it can have some association with liver. So again, this is another reason to talk to your doctor or your healthcare provider about which one is better for you as an over-the-counter remedy for pain. To the right, they also have Advil PM. That one just has, I think it's another antihistamine to help with sleepiness at night. Same with the Tylenol PM. So that was just the local Rite Aid here. I'm going to see what's over there. There's a Clark's Nutrition. I'm going to walk over there next or drive down there, see what's over there. But typically, if your doctor tells you you have a viral illness, they probably won't give you an antibiotic, or they shouldn't give you an antibiotic. And then they'll tell you to do something over the counter, or they'll say supportive care. So that essentially means just treat the symptoms. These are just some things that I have used myself, or that I have suggested to my patients. Always look at the ingredients on your medications that you get over the counter, because some of them have the same thing, so you don't want to double up on dosages. So make sure to look at that, and then of course don't ever go over the recommended dosage. I'm gonna head over to Clark's to see if they have anything else over there. If they don't have anything else, then the video will end after this, but if there is, I'll throw it in at the end. But hopefully this was helpful. Again, if you're making any decisions about your health, you should do this with consultation with your own doctor. This is not intended as medical advice. This is just some things that I have used when I or people at home at my household have gotten sick, and it's actually pretty interesting for me to go in to look, because I always hear people say the brand names and I'm not always sure what's in them. And as you can see in the video, there are several, like a brand will have several different variants, and the variants will have different ingredients. So it's actually useful to help for me to walk the aisles and look what's on the shelves. Have a good day. Stay healthy.